Hello everyone, welcome to E.L.E. Vision Sclera YouTube channel. We will begin with an anatomical overview of the eye and the surrounding structures. The first one is the orbit of the eye, or the bony socket. Now the orbit is a bony cavity, like a four pyramid that houses the eyeball and its supporting structures. Now its main role is to protect and provide a stable environment for what? For vision. Now the bones of the orbit, which are 7, we will start at the roof, formed by the frontal bone and the lesser wing of the sphenoid. This part protects the eye from trauma from above and also separate the orbit from the anterior cranial fossa, which is the brain. Now the floor, formed by the maxilla, zygomatic and the palatine bones, separate the orbit from the maxilla sinus. Now this wall, which is the floor, it's the weakest wall, which is prone to fractures when someone is involved in this, especially in accidents. It leads to blowout fractures, which lead to protrusion of the eyeball, either outwards or towards other structures, depending on the extent of the injury. The third one is the medial wall, which is formed by ethmoid, lacrimal, and the sphenoid bones. Okay. Now, very thin and also called the lamina papilla. This medial wall is towards the nose. Yeah, near the nose. It contains a lacrimal sac fossa, before tears into the anal cavity. Then the fourth one is the lateral wall, which is the strongest, thickest and strongest wall, which tend to resist about the injury. So this wall is formed by zygomatic bone and the greater wing of the sphenoid. Very strong ones. So this part is very important for surgical approaches. So surgeries related to the interior part, mostly the interior part of the eye and the back, can be done via the lateral wall. Then the apex is located posteriorly in the back, which houses the optical canal. Transmit the optic nerve, the cranial number 2, and the ophthalmic artery to access the globe. This is the diagrammatic overview of the orbital cavity. This is the roof, the medial wall, the floor, the lateral. Then this is the apex, which has the optic canal. So as you can see, different bones, different places, as we mentioned earlier. The zygomatic one, remember, the sphenoid, greater part of it. So this one forms the lateral wall, very strong. Okay. Yeah. So the second one is the extraocular muscles, which are 6 in numbers. So these muscles allow precise eyes movement, enabling tracking, convergence, and focus. So we have the superior rectus, move the eye upward, elevation, and slightly inward adduction, and rotates medially in torsion. So this is the superior rectus. Then we have the inferior, move the eye downwards, depression slightly inwards, adduction, and rotates laterally. In the third one, we have the lateral rectus, which pull the eye outwards, which is abduction. Okay. Now the medial rectus also pulls the eyes inwards towards the nose. Then we have the superior oblique, depresses the eye when adducted, abducts and intots, tilts to the eye towards the nose. Then we have the inferior oblique, which elevates the eye when adducted, abducts and extorts. This is a diagrammatic overview of the 6 extraocular muscles. Apart from the inferior oblique muscles, the rest of the muscles touches at one point, the apex of the globe. So we will learn later about this region and its importance, especially in surgical procedures related to the eye, especially in providing the anesthesia, the local anesthesia or the regional anesthesia. So that structure is accessory. This protect and maintain the eye health. So the first one is the eyelids, which protect against injury. The eyelid, which protect against injury. To also spread the tears and releases light. So these are just some of the functions of the eyelid, not all of them, but some. Later we'll learn about it when you go into details about the eyelid. Now it contains tarsal glands, which is membrane which secrete an oily layer. This oily layer now prevents the tear from evaporating. So disorders related to eyelid, some of them are cyan, what colors iron. Now this colors iron is related to the blockage of what? Membrane gland. Now the conjunctiva, it's a thin mucous membrane which keeps the eyes moist and provides immune defense to the eye. Okay, so it's usually divided into some parts. The conjunctiva, there are 3 parts. We start with the palpebral conjunctiva lines, the inner eyelids. So this one is for the inner eyelids. While you check for the paleness, that part, it's usually highly vascularized. So the inner eyelids, the papillary conjunctiva. Then we have the bulbar conjunctiva, which covers what? The sclera. Then it extends now from there into the junction. At the cornea level, we call it the corneal epithelium. It's still part of the conjunctiva. Yeah. Now I wanted to show you about the anatomical overview now of the conjunctiva. Now we say the palpebral conjunctiva. It lines what? The eyelid, right? Then when it comes to now to the sclera, say the bulbar conjunctiva, then it extends, lining the cornea as corneal epithelium, and continues as earlier explained. So when our patient closes his eyes, when you close this eye, you form a depression, a sac-like depression. Okay. So this is where we still have medications. We tell our clients or patients to what? Close the eyes. When they close the eyes, now the medications spread across what? Across the globe evenly. Lacrimal apparatus to include the lacrimal gland, which produces what? Tears. So tears is drained where the puncta, canalicular, lacrimal sac, nasolacrimal duct, then outwards via the nose. So this explains why crying causes a running. So most of the times when you are emotional, so you produce too much tears, and this drainage system also tend to do what? Trying to drain most of the tears, but most of them are drain outside while you're crying. So we have this system, the puncta, the canalicular, lacrimal sac, nasolacrimal duct. So that's the time that you start developing runny nose. Not because you are sick, but it's because of what? Too much production of tears. Now then we have the orbit fat, which fills spaces between the structures. So this fat helps in cushioning the globe and allows smooth movement of the eyeball. Now this is the position of the lacrimal superiorly. It produces the tears, which lubricates and nourishes the structures of the eye. Then when you blink, the tears are being forced via the punctum, the canalicular, then lacrimal sac, then outwards via the nasolacrimal duct to the nose. Neurovascular supply ensures the eye and orbit are well supplied with sensation, motor control, and blood. Okay. Now the nerves involved, one is the optic nerve, cranial number 2, which transmit information from the retina to the brain for interpretation. Then we have the movements. Nerves related to extraocular, muscles movements, which is the ocular motor, cranial number 3, trochlear, cranial number 4, and ablution, cranial number 6. Then we have trigeminal nerve, cranial number 5. It's a sensory division to cornea, conjunctive eyelids, and the forehead. So important in the corneal reflex, which include the blinking and the cornea is touched. Okay. Now the blood supply is via the ophthalmic artery, which is a branch of the internal carotid artery. Now the internal carotid artery at the brain, it forms the cycle of Willis. So this is the first intracranial branch of the internal carotid, which is the ophthalmic artery. Now the ophthalmic artery also branches to form central retinal artery. So it's the first intraocular branch, which is the central retinal artery. Now the blood is drained via the superior and inferior ophthalmic veins, is the cavernous sinus. Then clinical importance, this blood supply. Infections from the face, okay, can spread to the brain via this, via the blood supply. So lastly, we have the protective layers, so extra protective coverings around the globe. So we have the orbital septum, fibrous sheet from the orbital ring into the eyelids. So it acts as a barrier, preventing the spread of infection between eyelids and orbit. Then we have the Tenon's capsule, facial bulb. So it's a thin membrane that envelops the eyeball, separates the globe from the orbital part, and provides a small socket for eye movement like a lubricated sheath. So we have come to the end of our session for today. Thank you. Thank you for your time. I wish you like and subscribe for more of this content in the near future. Thank you.